Hello friends, welcome back to my channel Health Matters with Dr. Shritama Banerjee. At the very onset, I would like to remind you, please like, share and subscribe the video. And please comment in the comment section regarding your feedback or whatever else you would like to know from me. Now, coming to my present topic of discussion. Today, I shall be talking regarding arthritis, and my main topic is how to differentiate between osteoarthritis and rheumatoid arthritis. Now, what do we mean by osteoarthritis? Or what do we mean by arthritis in the very first place? Osteoarthritis is caused by the degeneration of articular cartilage surrounding bone, and it results in increased age group, and it is due to wear and tear as a result of frequent activities of joints. And what is rheumatoid arthritis? It is an autoimmune inflammatory disorder. So the pathophysiologies of both are entirely different. Now, discussing about the topic, why am I discussing regarding these two arthritis? What is the reason why I'm discussing this topic? I'm discussing this because both osteoarthritis as well as rheumatoid arthritis are arthritis. However, the presentations are quite different, and it is very difficult for the common man to differentiate between two. In our day to day practice, we encounter several patients presenting with arthritic symptoms, and there are one or two catch questions which we ask them to diagnose whether they have osteoarthritis or rheumatoid arthritis. So, I wanted to share this insight with you all because it is quite a common problem, and the patients really don't have any clue regarding what type of arthritis they have, because the type of arthritis they have, whether it's osteoarthritis or rheumatoid arthritis, the treatment regarding both of them is entirely different. So that common people have idea regarding what type of arthritis they have, that is why I'm discussing this topic. Now, coming to what is osteoarthritis. Osteoarthritis, as I said earlier also, it occurs as a result of degenerative changes of the articular cartilage surrounding two bones. Say if there is a knee joint, then there's one bone which comes like this. There's another two bones which comes like this. So the articular cartilage surrounding this bone and the articular cartilage surrounding the two bones here, they get worn out, and there is thinning of this articular cartilage, as a result of which there is decrease of the joint space. So this decrease in the joint space is one criteria which occurs on osteoarthritis, which we can see on an X-ray plate. Now, this osteoarthritic changes occur in increased age, and it occurs generally after 50 years of age. And the most common risk factor, modifiable risk factor, is obesity. Now, how do we diagnose obesity? Obesity is diagnosed by BMI of greater than 30 kg per meter square. And obesity is the most important risk factor for osteoarthritis. And osteoarthritis occurs in the weight bearing joints of the body. Most commonly and most earlier affected is the knee joint, followed by hip joint, and then hands and feet. And it is mostly affects the larger joints of the body, which are the weight bearing joints. And the other risk factors are female, uh, and increased age group, as I said, and obese population, and also the sports person who have activity involving uh, the larger weight bearing joints frequent activity, or it can also occur in any joint which has been injured but has not been appropriately treated. So these are the risk factors for osteoarthritis. And what are the joints which are most commonly affected? As I said, knee, followed by hip, and then followed by hands and feet. And in case of the smaller joints, which are less commonly affected in case of osteoarthritis, the joint which can be affected is the distal interphalangeal joint. So these are the phalanges, the fingers are the phalanges, and distal interphalangeal joint, that is these joints as I'm showing. These can be affected by osteoarthritis. And now coming to what is rheumatoid arthritis. Rheumatoid arthritis has a entirely different pathophysiology. So it's not a degenerative disease. It is an autoimmune disease which results as inflammatory disease because of autoimmunity, that is the immunity of the body attacks its own cells, not recognizing them as its own cells and recognizing them as foreign. So it attacks the own body cells, and then it attacks, and the autoimmune complexes which are formed, they are deposited on the synovial membrane that is surrounding a joint. Say there are, again taking the example of the knee joint, there is this bone at the top, these two bones at the bottom, and there's the synovial membrane surrounding this entire thing, and the synovial membrane on top of that is deposited the autoimmune complexes, and there is inflammation of the synovial membrane, and there is redness, warmth, and pain and stiffness. So this is rheumatoid arthritis, and the age group can be anything between 30 years to 60 years of age. So we can say that this can occur in relatively younger age group also, unlike osteoarthritis. And also females are very commonly affected, much more commonly affected by rheumatoid arthritis than males. And again, there has to be positive family history. That is, if you have a family member, close family member who has been affected by rheumatoid arthritis, you have much greater chance of having rheumatoid arthritis yourself. Then coming to smoking, if you are a smoker, then you have much more chance of rheumatoid arthritis occurrence in you. And then coming to which are the joints which are commonly affected. Now I have to say, which is very important, that this is polyarticular. That is, many joints can be affected at the same time. In case of osteoarthritis, it is either oligoarticular or monoarticular. That is very less amount of joints, or only single joint is affected at the same time. In case of rheumatoid arthritis, multiple joints are affected at the same time, and it is bilateral. That is, if the right side joints are affected, the left side joints are affected simultaneously. So it's bilateral in presentation. And the metacarpophalangeal joints. See, these are the metacarpals and these are the phalanges. So the joints in between the metacarpals and the phalanges, these joints, 1, 2, 3, 4, 5, and here again, these metacarpophalangeal joints are commonly affected as a result of rheumatoid arthritis, and also the proximal interphalangeal joints, that is, these joints are commonly affected in rheumatoid arthritis. And then coming to how will you diagnose on the basis of clinical symptoms, which you can yourself notice after a good rest, good night's sleep, when you wake up in the morning, if you have joint stiffness and pain, which is known as morning stiffness, you have to understand that is rheumatoid arthritis. And if you have joint pain after doing a lot of work, after doing a lot of activities, say from the morning you do a lot of activities and in the evening you have joint pain and stiffness, which is known as evening stiffness, you are suffering from osteoarthritis. So this is another key difference which you have to understand. Then coming to the diagnostic blood tests. So since rheumatoid arthritis is an inflammatory disorder, the inflammation is much more intense in case of rheumatoid arthritis. So inflammatory markers of the blood, which are ESR and CRP, are much higher in case of rheumatoid arthritis, and these are either normal or much less. increased in case of osteoarthritis. So ESR and CRP are much higher in rheumatoid arthritis uh, as compared to osteoarthritis. And also coming to specific markers for rheumatoid arthritis, which are rheumatoid factor RF and anti-CCP antibody. These both are positive in case of rheumatoid arthritis and negative in case of osteoarthritis. So, this is in a nutshell discussing between the differences of osteoarthritis and rheumatoid arthritis. So, osteoarthritis is much more common. However, both diseases are quite serious, and why is differentiating or why is arthritis diagnosis very necessary? This is because arthritis decreases the quality of life of a person. Say, even to do the ordinary activities of daily living, say getting a glass of water for yourself or going to the washroom, you have to seek help of others. So it decreases the confidence of humans, and it leads to a significant level of mental distress and mental problems. And this is in a nutshell discussing about arthritis. And also arthritis can lead to different problems as well, because it limits the physical activity which you can do as a result of arthritis in your joints. So you can do less physical activity, less walking is possible, and due to all these things you can get a chance of increased chance of cardiovascular disease, diabetes, high blood cholesterol, and other disease. So one disease brings in other diseases. And so this was my topic of discussion, discussing regarding arthritis and differentiating between two key types of arthritis, which is osteoarthritis and rheumatoid arthritis. So, hope you liked my video, and please do let me know in the comment section about your feedback, and do like, share, and subscribe to my channel. And I shall be back again with another video very soon. For the time being, stay healthy, stay safe, and bye bye.